Welcome to section 4 of immunodeficiencies. In this section, we'll be discussing thymic aplasia. We initially made this video for our biochemistry section as section 12.3, and it was titled DeGeorge syndrome. However, it also fits perfectly within these immunodeficiencies, so we decided to include it in both biochemistry and immunology. So if you've already watched DeGeorge syndrome in biochemistry, then feel free to skip over this one. All right, with this in mind, let's get started. This scene will take place during the time of the Revolutionary War. Notice that the American forces are at the top of a hill defending their land. The leader of this force is, of course, George Washington. In this scene, George Washington represents DeGeorge syndrome. He's one of the most famous people in history with the name George, so hopefully this will make DeGeorge syndrome easy to recall. Let's zoom up on this part of the scene to see some important details. Can you see the inscription on George Washington's rifle? That's right, 22. This is a .22 rifle that he's using to defend his country. The .22 rifle should help you remember that DeGeorge syndrome is a 22q11 microdeletion syndrome. So 22 rifle for 22q11 microdeletion syndrome. Okay, take a close look at the gunpowder pouches that the soldiers are wearing. There are two important details here. First, the pouch is shaped like a square. The square has 4 sides, so it represents the number 4. Second, there is an inscription of the Trinity symbol on their pouches. The Trinity is a Christian symbol used to represent the number 3. So in this image, it represents the number 3. Together, the square pouch and the Trinity symbol should help you remember that DeGeorge syndrome is caused by aberrant development of the 3rd and 4th pharyngeal pouches. The fact that the soldiers are wearing gunpowder pouches should help you remember that this is a reference to the pharyngeal pouches. Okay, let's zoom out and add some more detail to the scene. Notice that we've added some wooden pallets to the scene. These are being used as barricades and protection for the American troops during this battle. In this scene, the wooden pallets are used to represent that DeGeorge syndrome may result in a cleft palate. So wooden pallet for cleft palate. Okay, now let's add a few more soldiers so we can really see how this battle is unfolding. Now we have several British soldiers and a couple more American soldiers. As the British soldiers began invading this little peninsula, a battle broke out. Notice that during the fight, one of the British soldiers got shot in the face. He has his hand over his face and he's bleeding. This part of the scene should help you remember that DeGeorge syndrome can cause abnormal facies. So, guy shot in the face for abnormal facies. Okay, now we've added some thyme plants to the scene. The Americans have been using this thyme for food and medicine, so the British army is starting it on fire in an attempt to make the American forces weaker. The thyme represents the thymus, and the fact that it's on fire and being destroyed represents thymic aplasia. The 3rd pharyngeal pouch is normally responsible for the development of the thymus, so aberrant development of the 3rd pharyngeal pouch results in thymic aplasia. So thyme on fire for thymic aplasia. Notice that a cannon has been added to the scene. If you look closely, you can see that the shadow of the cannon is on the ground, but it doesn't actually cover the thyme crop. The shadow is right in front of it and right behind it, but not on it. This alludes to the idea that in DeGeorge syndrome, there will be an absent thymic shadow on a chest x-ray. So the cannon shadow not covering thyme represents an absent thymic shadow on chest x-ray. If you think back to American history, you'll recall that around the time of the Revolutionary War, American colonists became frustrated with Britain for imposing a tax without representation. So they dumped a large supply of British tea into the harbor. This became known as the infamous Boston Tea Party. So in this scene, we'll show 3 American soldiers dumping tea and other British supplies into the harbor. Let's zoom up a bit so you can see this better. Notice that just like the actual Boston Tea Party, this guy is dumping British tea into the harbor. The tea here represents T cells. And the fact that he's dumping it out alludes to the idea that DeGeorge syndrome results in a T cell deficiency. The thymus is normally associated with T cell development, so hopefully it makes logical sense that in this disorder, patients become T cell deficient. So again, tea getting dumped into the water for T cell deficiency. This is a bit of an embellishment of history, but notice that this guy is dumping out some pears into the harbor. The pears represent the parathyroid glands, and the fact that the pears are being destroyed represents that this disorder results in parathyroid aplasia. So pears being destroyed for parathyroid aplasia. Because the parathyroid gland is aplastic, these patients will also show decreased levels of PTH. Finally, notice that this 3rd guy is dumping out a bunch of milk into the harbor. Milk is notorious for containing a lot of calcium, so in this scene, it will represent calcium. The fact that it's being destroyed represents hypocalcemia. As we just learned, the parathyroid glands are aplastic, so it should make intuitive sense that calcium levels would be low. Recall from endocrinology that the parathyroid gland releases PTH, which ultimately causes the body to increase the levels of calcium. So if the parathyroid glands are aplastic, then this would cause hypocalcemia. So again, milk being destroyed for hypocalcemia. Okay, now let's zoom out and discuss a few other points. Notice that we've added some mushrooms next to the thyme crop. Mushrooms are considered fungi, so in this image, they represent that DiGeorge syndrome results in recurrent fungal infections. Now we've added this guy on the stretcher and a nurse who's helping him. Just like in other videos, the stretcher here is a reference to a compromised immune system. The nurse is using thyme as a medicine to help you remember that thymic aplasia results in a T cell deficiency, which results in a compromised immune system. So the guy in the stretcher for compromised immune system. Just like we learned in history, the British Army was well supplied, so we'll show a bunch of carts and British supplies in this scene. These carts represent that DiGeorge syndrome results in cardiac defects. The trunk on the back of the cart is a reference to conotruncal abnormalities. A couple examples of conotruncal abnormalities include tetralogy of Fallot and truncus arteriosus. The pharyngeal pouches are also responsible for proper heart development, so it should be no surprise that this disorder can cause cardiac defects. So again, trunk for conotruncal abnormalities. Finally, this British guy here is using bellows to make weapons for the British Army. Bellows sound kind of like velo, which is a reference to velocardiofacial syndrome. Another type of 22q11 deletion syndrome is velocardiofacial syndrome. Oftentimes, velocardiofacial syndrome, 22q11 deletion syndrome, and DiGeorge syndrome are used interchangeably, but you should be aware of the name velocardiofacial syndrome. So bellows for velocardiofacial syndrome. And there you have it, everything you need to memorize about DiGeorge syndrome.